This podcast is sponsored by the online course, Intro to Psychology, with Dr. Bo Bennett, PhD. Uncover the secrets of the human mind and transform your life at introtopsych.com. Start your journey today.
Understanding Cognitive Behavioral Therapy Research, a Psychology One-to-One Guide. Explore the research behind cognitive behavioral therapy and its role in psychology education. Learn how CBT changes thoughts, emotions, and behaviors effectively. Hey there! So today, I wanted to chat a little bit about something that's been at the core of modern psychology for decades: cognitive behavioral therapy, or CBT. If you've ever wondered why this approach is so widely used in therapy and mental health treatments, you're in the right place. Plus, there's a lot of fascinating research behind it that not only proves its effectiveness, but also explains how our thoughts, feelings, and behaviors are interconnected. Let's start with the basics. Imagine you're dealing with anxiety or depression, and you notice your brain keeps running through negative thoughts like a broken record. CBT is built on the idea that our thoughts directly influence our feelings and behaviors. So if we can change those unhelpful thoughts, we can actually improve how we feel and act. It's pretty empowering and it makes a lot of sense. Now, as a psychology professor, I appreciate when people get a clear grasp of foundational psychological concepts. CBT sits right alongside some of those classic psychology theories we cover in Intro to Psychology. For example, how cognition shapes emotion, or how learned behaviors become patterns that influence our mental health. It's one of those topics that really bridges theory with practical everyday use. The research behind CBT. Over the years, research has consistently shown that CBT is effective for a range of issues: depression, anxiety disorders, PTSD, OCD, and even some eating disorders. What's great is these studies don't just rely on anecdotal success stories, but use rigorous randomized controlled trials to prove it's actually a reliable form of treatment. One particularly interesting area is how CBT helps patients recognize and challenge cognitive distortions, those pesky biased or irrational ways of thinking. For example, all or nothing thinking, where you see things in black and white, or catastrophizing, where you expect the worst-case scenario no matter what. Studies demonstrate that when people learn to identify these distortions and replace them with more balanced thoughts, their symptoms improve significantly. Research also shows that the structure of CBT, its goal-oriented, time-limited nature, is highly beneficial. Unlike traditional psychoanalysis that can last years, CBT typically lasts between 12 to 20 sessions. This means people can start seeing changes pretty quickly, which is a huge plus in mental health treatment. Why does CBT work? A look at psychological concepts. There are a few key psychological concepts underpinning why CBT is so effective. Thought records. These tools help individuals track and analyze their thoughts throughout the day, making it easier to spot negative patterns. Behavioral experiments. This is where people test out new ways of thinking by changing their behavior to see what really happens versus what their anxiety might predict. Thought challenging. Actively disputing irrational thoughts and replacing them with more rational alternatives. All of these concepts are grounded in the basic principles of cognitive and behavioral psychology, both prominent Psychology 101 topics. They demonstrate how changing your mindset can trigger a cascade of positive emotional and behavioral outcomes. The bigger picture: CBT and psychology education. If you're passionate about understanding why people think and behave how they do, studying these psychological theories is a must. In fact, the Intro to Psychology course by Dr. Bo Bennett on the Vivacity.com platform offers a fantastic way to get a solid foundation in these and other psychology topics. This course does an excellent job breaking down complex concepts into easy-to-understand lessons, perfect for anyone curious about human behavior. Whether you're a student, a budding therapist, or just someone fascinated by how the mind works, exploring courses like this can seriously deepen your understanding of psychological concepts like CBT. And knowing about these topics doesn't just help in academics or careers, it can provide tools to better handle your own mental health too. Wrapping it up. To sum it all up, cognitive behavioral therapy is one of the most well-studied and effective treatments in psychology. Its focus on changing thought patterns to influence emotions and behaviors is backed by decades of research and practical application. The idea that by reshaping how we think, we can change how we feel and act is both hopeful and empowering. If you want to learn more about CBT or other psychological concepts, I can't recommend enough checking out the Intro to Psychology course by Dr. Bo Bennett on the Viversity.com platform. It's a fantastic starting point for psychology education, built to give anyone a clear understanding of human behavior, including fun and engaging lessons on psychology theories and trending psychology topics. So if you're curious about these psychological topics or want to get started on your psychology journey, enroll now and understand human behavior better than ever before by visiting https://introtopsych.com.